Adolescence, a time of remarkable physical, social, and emotional development. Young people's experiences during this period represent a sensitive window for both risks and opportunities for lifelong well-being. Hi there, my name is Marvin So. I'm a medical student at the University of Minnesota, and I have the pleasure of sharing our study. It is well established that sufficient sleep supports emotional well-being and functioning, but less is known about how sleep and mental health relate for diverse groups of youth, or how parents might impact this relationship. A better understanding of these gaps could inform services and policies to better support young people, particularly those we know who are at greater risk for poor mental health. To answer these questions, we analyzed cross-sectional survey data from over 100,000 Minnesota public school students in 8th, 9th, and 11th grades. These students reported on demographic factors as well as the number of hours they slept on typical school nights, how well they could talk to their parents about their problems, and mental health indicators. These indicators specifically included recent depressive symptoms, using items from the Patient Health Questionnaire 2, and suicide ideation and suicide attempt within the past year. So what did we find? First, the majority of youth slept less than 8 hours per night, which is the amount recommended for this age group. They also reported a high degree of parent-child connectedness, though there were racial ethnic differences. For mental health outcomes, about 1 in 5 youth reported depressive symptoms, 1 in 10 reported past year suicide ideation, and 1 in 30 reported past year suicide attempt. There was overrepresentation of American Indian Alaska Native, Latinx, multiracial, and Pacific Islander youth for all of these adverse outcomes. Second, we saw that youth who either got more sleep or had more parent connectedness had lower odds of depression, considering suicide, or attempting suicide. This was true for most racial ethnic groups, even when accounting for sociodemographic factors that might explain the relationship. However, the strength of relationship varied by group. For example, each additional hour of sleep was associated with 20% lower odds for suicidal thinking among Black youth, but 33% lower odds for suicidal thinking among Latinx youth. Finally, we found that when youth reported good parent connectedness, sleep was even more protective for their mental health. However, this interactive benefit for the overall sample only held for white and Asian youth when we conducted our within-group analyses by race ethnicity. So what do these results tell us? Our study drew on a large statewide sample of public school students, which included estimates for understudied groups such as Somali, Hmong, and American Indian and Alaska Native youth that are often unavailable in other adolescent health reports. It therefore provides valuable information for stakeholders working to support particular ethnic groups and advance health equity. Although limitations such as the cross-sectional design certainly need to be considered, our findings have many implications. For example, clinicians can assess and counsel about sleep and parent-child connectedness concurrently and emphasize their synergy in working with youth and families to treat or prevent mental health problems. Decision makers and administrators could promote adolescent mental health by supporting policies and interventions that bolster sleep, such as later school start times, or foster sensitive, stable family relationships, such as positive parenting programs. Finally, researchers can build upon our study using longitudinal designs that follow young people over time. They can also continue to push pediatric research towards centering youth of color and conducting intersectional analyses. More details can be found in our paper published in the Journal of Developmental and Behavioral Pediatrics. I encourage you to take a look and consider how the findings may apply in our collective effort to improve the lives of youth. Thank you so much.